Should I at any point be paying attention to the Q&A and the chats, or is it basically just keep it on the video screen?
I think on video, because they're going to, the moderators will feed us the questions, I believe.
Yes.
Perfect.
Yeah, we will. Yeah, me and myself and Nee will be reading the questions out, and a few other students as well. Hi, everyone. Who's again? We're going to wait just a few more minutes till 6:05 to officially start the webinar. Thank you for coming. We're looking forward to engaging in this conversation.
I don't know if Hannah's on here, but Hannah, thank you for all the communications and organizing. I know it's a team, but you were sending a lot of those emails out. Thank you.
Yeah, it's definitely been a team effort. Thank you so much.
Yeah.
Hi, Dr. Crawford. Thank you for coming. Just a quick update. We're going to wait till about 6:05 before we officially start, just to make sure everybody can get in. All right, so it looks like we have a decent amount of participants. So we'll officially start the webinar. So first, I'll just jump into a quick introduction, and then we'll really get into the meat of this conversation. So I just wanted to introduce myself. My name is Linsa. I'm a current second year here at Harvard Medical School, and I'll be serving as one of the moderators along with me, who will introduce himself a little bit later. So before we start, I really wanted to just give a brief introduction to the webinar and give some broader context as to why we're having this conversation in the first place. And first, I want to thank the webinar team. It wasn't just me and Nee who helped make this event possible. So I'm just giving a quick shout out to Hamla Emanuel, Norma Hilton, Shayo Wijay, Ahmed El Naim, Jalen Benson, George Hutchins, and Dominic Falcone. They're instrumental in getting this set up. So to start, so we at the Harvard Medical School chapter of the Student National Medical Association want to officially welcome you to our webinar titled Racism as a Public Health Crisis, Police Violence and Vigilantism. So as we wrote in our statement to faculty and students, we first want to acknowledge that the past few months have been extremely difficult for many of us, especially those in the Black community. George Floyd's murder at the hands of the Minneapolis Police Department has sparked nationwide protests calling for an end to the long history of police brutality and racism in this country. Systemic racism permeating our society and our justice system has allowed the lives of people like Tony McDade, George Floyd, Breonna Taylor, Ahmaud Arbery, and countless others to be stolen with impunity. As part of SNMA, we will to use our position as future healthcare leaders to address the disproportionate challenges that Black communities face to their health. Systemic racism, inequity, and violence are not confined to the fields of law or criminal justice alone. We must recognize them as public health and medical concerns that necessitate policy changes within the healthcare system as a whole. In line with this mission, we organized this webinar to create a space for broadening awareness of how racism and police violence detrimentally impact the health of the Black community. And importantly, also how each of us can and must act to drive systemic change in the pursuit of racial justice. Without further ado, I'd like to briefly introduce our wonderful panelists who will be sharing their knowledge and expertise with us. So we have Professor Lindo, who serves as a critical race theory scholar and also on the faculty at the Department of Family Medicine at the University of Washington School of Medicine. We have Dr. Christine Crawford, who is a child and adolescent psychiatrist and works in mental health disparities at the Boston University School of Medicine. We have Lady Lardy, who is a strong community advocate, a founding member of Housing Equals Health, and also serves on the City Life Vida Urbana leadership team. And then we have Councilman Ricardo Arroyo, who serves as the City Councilor in District 5 for Boston, Massachusetts. So with that, we'll move into the first phase of our webinar and ask the panelists to introduce themselves. And these are the questions that they'll be basing the introductions off of. To start, could we have Lady Lawrence Carty?
Thank you, Terrence. Thank you for inviting me here to represent Housing Equals Health, which works at the intersection of public health and housing justice under the principle that those most affected must lead. That principle is at the core of all my advocacy for affordable housing. The Renters Rising Coalition, the People's Assembly, the IDP Coalition for a Truly Affordable Boston, as elected co-chair of the City Life Vida Urbana leadership team, and serving on the board of City Life Vida Urbana, as well as the board of the Boston Neighborhood Community Land Trust. Speaking from lived experience of police violence. I was gay bashed in the middle of the day because I am gender nonconforming. I sustained serious injuries requiring multiple surgeries and permanent nerve damage, and more surgery to come. After being attacked, I called the police. The dispatcher was hostile. I gave a description: about 24, white, 6 foot, black hair neatly parted, and a navy cloth coat. When the police arrived, one of them went to handcuff me. A bystander stepped up and said, "I saw him get attacked from behind." This was met with an angry, "Were you on the train? Did you see what happened on the train?" She stood firm and they took statements. I had every reason to be angry that I was almost arrested for calling the police while black. I wasn't a 24-year-old, 6 foot white male with black hair, neatly parted, and I didn't have a coat. I politely answered the officer's questions. At the end, I asked why he kept saying jacket. He told me the dispatcher said jacket. I said, well, that's annoying because I was specific about coat. The officer raged at me for being annoyed, with blood vessels popping. I thought Fruitvale Station and froze. It was the police, not the bashing, that made me afraid for my life. Later through Fenway Health, we met with the MBTA police. I didn't have the officer's badge number, but describing his behavior was enough for them to know which officer it was. That they could so easily recognize him from this behavior and he was still carrying a gun was enough for me to recognize that this meeting would not change anything. My reality as a Black person is that cradle to grave, we have to survive despite the constant assault on our health from systemic racism. Unhoused people are policed every minute of the day, whether on the streets or within the system, because they do not have any private space. As much as the threat of police violence looms over me, I can't imagine the level of danger I would face if I were not lucky to have the privilege of a home. To some degree, all Black lives sustain this chronic stress. Black lives aren't the only ones to be cut tragically short by police violence. But the difference is that white lives are not at increased risk because they are white. Black lives in this country are shorter because systemic racism threatens us with violence throughout our lives. Because we care about each other, even if we never encounter police violence directly, it still affects our health. Because that concern we feel for each other as community means we are in distress from the risk of police violence to others as well as the personal risk. We pay the price of living in America while Black and harm to our health, such as hypertension, diabetes, coronary disease, and heart failure. This community-wide stress also takes a toll on our mental health. The damage to our health is not just physical. I still have PTSD from the MBTA police, but even without that trauma, growing up, learning that I have to keep my hands in view and not reach for my registration at a traffic stop, internalizes the knowledge that being Black means I can be killed for nothing. That reality carries lifelong stress. Police kill some of us in minutes with bullets, but the threat of police violence is killing all of us in slow motion, as that lifelong stress cuts away at our health year after year, decreasing our life expectancy. I don't feel safe in my home. That is not PTSD. It is a rational, fact-based concern. From when I was a student in Cambridge and called the police because a drunk white male belligerently refused to leave my front porch, until this very day, every time I called the police, it was because of a white aggressor. On only 2 of those calls, the police acted to protect me without reservation. So if a white intruder broke into my home at night, I have to worry that the police would shoot me instead of the intruder. That's a reasonable fear given my life experience with Cambridge and MBTA police threatening to arrest me instead of protecting me when I call them. Defunding police and allocating excess funds to affordable housing and tenant homeowner protections from being homeless will make Black lives safer from police. Black lives and all other lives too. Thank you.
Thank you so much, Lady Lawrence. We really appreciate you sharing that. And next, for our introductions, we will go Professor Edwin Lindo.
Thank you. Lady, I really appreciate those words. Thank you for sharing that. I also want to start us off by acknowledging the land that we stand on, at least where each of us are, Indigenous people that were the stewards that held it, that protected it, and acknowledging that it was stolen and taken without compensation, and we still profit off of it. And so in your communities, if you can find ways to organize with, to support and uplift those Indigenous communities, I would ask us to do so. The communities that I work with are very similar to the ones mentioned by Lady Lawrence, communities that are historically oppressed, marginalized, dispossessed, where livelihood and humanity has been stripped and taken, mostly because we are melanated and because we are poor. Those are communities that I worked with growing up, being one of those young folks, but also in the community that I currently live in Seattle, Washington. These are communities that society, this country has insisted are less than human. And when I say insisted, I don't mean in a hyperbolic sense. I mean, they literally said that in the first Congress of the United States of America. They said it in the decisions outlined by Supreme Court justices. They've said it by the research journals that publish false information that Black and brown bodies are inherently flawed when compared to white folks. That's what I mean by insisted. And so how does racism affect the health of these communities? It is rampant. I think it's now time that we pathologize racism the same way that we seek to address the issues that affect the pathology of our bodies in a more biological sense. And what I mean by that is, let's look at cystic fibrosis. Cystic fibrosis, just last year, received $3 billion in research funding. There's only 30,000 incidents of cystic fibrosis in the United States. You have Black folks that are dying at the rate of measles in these United States, and we're investing more money in the community, in the institutions and apparatuses that are killing those folks, and not actually trying to address or deconstruct why those killings and murders occur. We look at the disproportionate effect of unemployment, the disproportionate effect of concentrating poverty in neighborhoods that are overwhelmingly Black and brown folks. That's not an accident, right? We see how racism affected our communities by redlining. Here in Seattle, I know it occurs in Boston, but redlining, whether it's de facto or whether it was written into the law. Here in Seattle, if you live north of Madison Avenue, it said in the grant deed, you cannot sell this home to a Mongol, a Negro, or a Jew. Racism is the DNA of this country. It's not that we are suggesting that it can be better. What at least I'm suggesting, it has to be inherently overhauled, deconstructed. When people say, well, we have a constitution that speaks to the values of this country, that all men are created equal. Well, all men at that time meant white men that can own land. We are attempting to make a system do what it never intended to do. And so that's the same understanding, the same truth of policing. If we look at the history of policing, you go to the South during chattel slavery, and in that time you had deputized individuals, white men that put a badge on that said, my job is to catch runaway slaves. And that's what they did. What's eerie, however, is that their job was to catch runaway slaves and keep them alive. Today, in 2020, the police don't even have that responsibility, because it's not valuable enough life or property to actually keep Black and brown folks alive. So the interactions are treacherous, they're scary, they're impulsive. When I see red and blue lights, I freeze. I was taking my daughter to school on the bicycle, putting her in the back of the bicycle seat, and she heard the sirens ringing. And she looked at me and she said, Daddy, are they coming for you? She's 2.5 years old. They've convinced my daughter that I'm a target in a system where melanated skin will be and has been proven guilty just by the fact that we walk on this earth. And I think it's time that we have these real conversations of what approaches we do take. Some may say that it's too radical, but I would argue that there is a strong intellectual space to start wrestling with abolition. Wrestling with it in a way that we say, abolition is the imagination of a justice that we've never seen before. Removing police that's the easy step. Let's free up the funding. The hard step is actually imagining, like Octavia Butler tells us, imagining that justice, that creativity of a world that is so hard to imagine because we've never felt it. We don't know what it's like to feel free. We've been convinced of it. We've been sold the bill of sale that, oh, you live in a free state. And I tell folks in communities, I'm only as free as these walls have told me to. But between hundreds of thousands of dollars in debt, being evicted from a home that I lived in for 35 years when I was a child, freedom is hard to pin. And I would ask us, let's break ourselves from the limitations of reality and actually start exploring the ancestors that have told us the possibility and the reality is there, but we have to be imaginative.
Thank you so much for those words, Professor Lindo. I think next for introductions, we'll go with Dr. Christine Crawford.
Hi, everyone. Can everyone hear me? Thumbs up? Okay. I'm so happy to be a part of this panel, and the fact that HMS has taken time to put together this webinar to address this issue just truly demonstrates how strong of a student body you have at your institution, and how you guys really have made it a point to go beyond your studies as medical students to explore ways in which you can make this world a better place by raising awareness of what's happening in society right now and what's been happening in society for hundreds of years. So I just want to say thank you to SNMA for putting together this webinar. As was already mentioned in the introduction, I'm Dr. Crawford. I'm an adult, child, and adolescent psychiatrist at Boston Medical Center, which is a hospital in Boston that has historically treated the most vulnerable patient populations within the city. And it's a place in which Black and Brown people in the state feel comfortable receiving their care, and also feeling comfortable that they're receiving care from individuals who are reflective of their community. So I'm really happy to have the privilege to work there. As a psychiatrist, I see the tremendous impact that stress and trauma has on the emotional and physical well-being of Black and Brown communities. And I'm going to speak specifically to the Black community throughout the duration of this webinar. And what I mean by the direct impact of trauma and stress on the mental health is I see that in multiple forms. I see that in children who've been experienced or exposed to adverse childhood exposures. We call those ACEs. And what we do know is that when kids are faced with adversity, they have an increased likelihood of experiencing significant adverse outcomes later on in adulthood. We know that they're at increased rates of developing heart disease, developing substance use disorders, as well as a number of mental health conditions. And we now know that one of the levels of adversity that kids can experience is racism. And so there's been evidence to support that chronic exposure to adversity, including racism, can actually have a direct impact on children's brain development over time. And what happens is constant exposure to toxic stress can disrupt some of the connections within the brain, within critical parts of the brain, the hippocampus, the amygdala, the prefrontal cortex, that makes it such that children have difficulty regulating their moods, regulating their emotions, having difficulty paying attention and focusing, which can result in poor outcomes in school, as well as different learning disabilities. And so it has significant impact on how kids develop and become adults. Not only am I concerned about the impact that racism has on children, I'm also concerned about adults, because adults are the ones taking care of these children. We do know that there's been evidence to support that adults who hear about experiences of unarmed Black people being killed by police, we know that there's an increase in the amount of negative mental health days that they experience just by virtue of hearing about this killing on TV. We know that the number of poor mental health days that Black people experience when they hear about a killing of an unarmed Black person results in a total of 55 million poor mental health days, which is nearly the same poor mental health days we see for people who have a chronic medical condition like diabetes. Now, hearing that, just seeing the effects of the poor mental health days by just hearing about these events, just gives you a sense that even though we may not be directly experiencing it, experiencing vicarious racism, seeing these images in TV can trigger these stress responses. We know that being exposed to stress, trauma, what have you, can increase your heart rate, increases your blood pressure, and overactivates the fight or flight response, which has been attributed to a number of negative outcomes. And so what I hope to do and what I do in my work day to day is I try to address the emotional and physical impacts of all the stress that they're experiencing and the trauma, while validating their experience without putting blame and making it such that they feel as though they've been gaslighted in some kind of way. It's important to know that race-based trauma exists, that there is something called race-based traumatic stress injury, and it's a real thing, and there are symptoms that are similar to what we see in PTSD and other psychiatric illness. So I try to raise awareness that hearing about what's happening with the police, these interactions on the streets of police harassment can have detrimental effects on mental health. And I hope to provide treatment, not just in the form of medication, but in forms of therapeutic supports and other supports to make sure that they have what they need to maintain their physical and emotional well-being.
Thank you so much, Dr. Crawford. That was extremely informative. And then last but certainly not least for our introductions, we'd like to start with Councilman Arroyo.
Thank you so much. And just by way of background, my name is Ricardo Arroyo. I was a public defender with the Committee for Public Counsel Services before I became a city councilor. That's my district, District 5, which most people are like, what's that mean? It's Hyde Park, Mattapan, and Rosendale. So those are 3 neighborhoods in the city of Boston, and collectively, there's 75% people of color, 40% immigrant. Notwithstanding that, in my election, and this is my first term, I was the first person of color to win this seat. No person of color has ever held this seat. And why I ran had a lot to do with racism, to be perfectly frank. You know, I was 7 years old in my neighborhood when I got hosed by a neighbor, literally with a hose, because I walked on their sidewalk. And so my neighborhood is now 75% people of color, but when I was growing up, it was actually 70% white. And some big names came out of my neighborhoods, right? You had Dan Conley, the former DA. You had Mayor Menino, who was our mayor for 20 years, lived there for a very long time. And so it was kind of the belly of a lot of our politics on a municipal level, and municipal politics impact people's lives on a daily level, if not always, often more than federal or state government. And so when I ran, you know, I had a focus on racial equity. It was literally something I put in all my things. And I said, if I'm going to lose this race because I focus on racial equity and social equity, then so be it. But if I win, then I have a license to do this. And so when I won, I proposed way back in February, racism is a public health crisis. And at the time, I remember some folks thinking that that was like a radical thing, that racism is a public health crisis was like, whoa. And what I was explaining to most folks, and I still spend it because the mayor recently made the declaration himself, is that at the time, we knew that the Boston Public Health Commission. Oh. Should I keep going without the recording going?
Sorry, I don't know whether the recording stopped. Just get that back on real quick. It still says it's going on my end.
It says recording.
So I think we're fine. You can keep going.
Yeah. So at the time, the Boston.
Yeah, I think you can keep going. So yeah.
Perfect. So at the time, the Boston Public Health Commission had already found they had 26 social determinants of health. They had already found and stated that every single one of those social determinants of health had been impacted independently by racism. They'd also already found at that time that racism itself, the act of somebody being racist to you, had a health impact. It raised all kinds of different issues. And so at the time, that declaration to me was the equivalent of saying water is wet, right? That wasn't a big deal. What I was trying to do, which wasn't part of the mayor's declaration, was create a separate independent office that analyzes everything that comes out of City Hall using a racial social equity lens and publicly reports that information before its implementation. So if there's an idea that comes out of City Hall in the form of an executive order, an ordinance on the City Council, it has to go to this office. That office says this raises racial inequity in these ways. And then you, the people, get to see that and hear that. And then before it gets implemented, there's a debate about that and you can structure it and fix it. That wasn't part of what was proposed as a solution. What's proposed as a solution was diverting $10 million in police spending into, you know, trauma and health. And one of the things that if I say one thing multiple times during this thing, it's that systemic problems require systemic cures. If you're just dealing with the symptoms, if you have a process or a system that repeatedly creates racist outcomes, and that those racist outcomes lead to destabilizations in housing or less opportunity or educational achievement issues, if you're doing that over and over again, you're just treating the symptoms without treating the illness itself, which is the system itself, then we're wasting a lot of time, we're wasting a lot of resources, we're not getting to the root of this issue. And every chance I get to beat the drum for that, I do. The focus on policing here, I think I want to bring it back to that, because I think it's important to understand racism as a public health crisis impacts everything. Specifically, when we talk about policing in Boston, 70% of stops by police are Black folks. They could be Black Latino or Black African, but that's not how they break it down. It's just Black. 70% of those stops are Black. We are often held up as a model for community policing. Often in my experience, community policing is another way of saying more police in your community. And that's not the same thing. And I just want to be clear when we talk about safety and security, because folks try to say that this is a safety thing. True safety comes from addressing those root causes of these inequities and these poverties and these kinds of lack of opportunities. Security is a different thing entirely. And I would say that for most people of color, police in their communities, I'll speak for myself, police in my communities, policing for me does not equal security. And so I think that those kinds of conversations have to happen. Unfortunately, our budget was passed. I was pushing for more of a divestment into community process and community money out of the police overtime. Just to put this in context, the quickest way, we have public health, we have a health and human services department. Anything you can think about, our community centers, our senior programs, our youth street teams, our trauma teams, the Boston Public Health Commission, all of those things are housed in that cabinet. That cabinet, if you put that up against the Boston Police Department budget line, it's 250% more. We put 250% more dollars into our police than the entire cabinet that deals with health, deals with our seniors, deals with our youth, deals with our youth employment. And that's in the middle of a pandemic. And that's with us trying to become a nationwide leader on addressing racism. And so those kinds of issues and prerogatives and where we advocate and how we push for that is a major focus of mine. I will say that I've had my own interactions with stop and frisk with police. I gave a speech about an interaction I had with a state trooper with the rest of our elected officials of color when we presented a 10-point plan. And so I'm happy to discuss some of those things. I will say some of those things are traumatic. And so in terms of speaking about secondary trauma and things like that, they do have an effect even on somebody like me, who is an elected official and discusses these things. And so I think it's important for us to be aware of that.
Thank you so much, Councilor Arroyo. Hi, everyone. My name is Nia Arwade, and I am a third-year medical student here at Harvard Medical School. I've been a member of SNMA since arriving to medical school. And I'm really excited to be here today moderating a session alongside Terrence on a topic that, as you can clearly see, is as critical as ever. Dr. Crawford, Mr. Lindo, Mr. Cardi, Councilor Arroyo, thank you guys so much for being here today and sharing such an incredible, already impactful introductions. I'm looking forward to continue hearing from you, your voices, your experiences, as well as your insights as we strive to develop our own toolkits to combat racial injustice and inequality. So to start off the Q&A, Terrence and I will ask each panelist a question. Well, we hope that during this time, everyone here, the audience, can answer their own questions, and we will work to get through those questions to the panelists, and they'll be answered either verbally or by a written typed response. And with that, I'll give it back to Terrence for the first question.
Awesome. Thank you, Nee. So our first question is directed towards Lady Lawrence Cardi, and if there's time for other panel members to speak to this question as well, we would love that. So the first question is, how have your personal experiences highlighted the necessity of systemic police reform? I know a lot of the jargon around this issue says, there are only a few bad apples in the police system. But really, I feel like a lot of the experiences that we've heard from just the panel members alone have shown that systemic police reform is really necessary. So, Lady Lawrence, you can speak to that a little bit. Lady, you're still muted.
Sorry about that. I can speak to that in two ways. One, just even going back to that experience that I related, the officer that came up to me and started to handcuff me, that was the good cop. The other officer was in such a rage. He walked off. He was going up the escalator. The first officer had, said, "Where is he?" I pointed up there. He went up the escalator, and this individual was in such a rage he didn't come back. So the one who started to handcuff me came back and told me he basically said, "I hope you don't think we're all like that." So in his mind, he's seeing himself as disapproving of the way in which this Black person is being treated. But he walked up to arrest me. I mean, it's just, to me, that just, it's not the question of the actor, it's the question of the whole structure of the situation. Another time I was gay bashed at Central Square in Cambridge. The officer who arrived was Black. He didn't do anything hostile, but his experience as a police officer was such that when he and I figured out that the dispatcher deliberately sent the officer in the opposite direction as opposed to away from the bashers, I wanted to complain. And his point was, it's just not going to make a difference. And there was no malice in it. He just, it won't make a difference. So, but again, like as Councilor Arroyo and others have said, the systemic problems require systemic solutions. I mean, the system of policing and police violence is one in which there's no accountability, and police are used in inappropriate situations. If you look at unhoused people, they're particularly vulnerable because they're surveilled by police in every single aspect of their life. And the interventions that you get from someone with a gun are not the interventions that are needed in terms of community services. A traffic stop or, shoplifting shouldn't be enough for you to die. I'll go ahead and let somebody else contribute.
I'll jump in. Do we have time, Terrence?
Yes, I think we do.
Okay.
Yeah.
Quickly, just want to share the experience of growing up in San Francisco, being a young brown man, maneuvering the streets with friends, so group of Black and brown teenagers in the Sunset area, which is predominantly white, standing in front of a bank, and the police rolling up because the police were called, opened their doors, put their guns out, and said, "Get on the sidewalk." And we sat on the sidewalk. They said, "Put your hands behind your back." Guns again pointed at us. And they said, "People said you were trying to rob this bank." It was 7 o'clock at night. We were walking to get a pizza, and we now became bank robbers, which is a federal offense. And they then said, "Give us your ID." We gave them our IDs. And they said, "Well, you're lucky we're not going to charge you with loitering in front of a police or in front of a bank, because that's also a felony." And it's almost as though the grace they're offering is, you're lucky you're not a bank robber, because we presume so. And we could charge you with this, but we're not. We just had to sit there for 2.5 hours until they cleared everyone's name. That's one of many experiences, but we were lucky to not have the death sentence in that situation. I had friends, there were 5 of them: Alex Nieto, Mario Woods, Luis Gongorapat, Jessica Nelson, who were shot and killed by police in a span of 16 months, which led me and 4 others to do an 18-day hunger strike in front of the police station on 17th and Valencia. demanding that the police chief get fired. And we stood there in tents in front of the police station. And what happened was the city said, what is happening right now? Why does it take people not eating for 18 days for y'all to act right? And I say that because it's that personal experience that really drove my work to continue the organizing, be with community. Because as Frederick Douglass says, there is no progress without demands, and there is no justice without organizing and without fighting. And I think that's what we have to do, which is perfectly fine. The thing is, and I want to share this to for the medical students and for those in medicine, many folks believe that medicine is apolitical. And I think it's a fallacy to believe that and to embrace that, because the truth is that medicine from day one has proven to be incredibly political. It has racialized people for the purposes of creating a social political hierarchy and taxonomy. It said Europeans are here. It said Black and Native folks are down here. And that was in 1676. And still in 2020, we still use those racial categories. We still look at, if we define race as Dorothy Roberts and many others do, that race is a social political construct for the purpose of hierarchy and power to determine how we allocate resources. And that's what it's been used for and continues to be used for. So how do we deconstruct it in a way that we say we're no longer going to allow that, and we want justice, but it only occurs if we're actually willing to demand and fight for it.
Thank you so much, Ms. Lindo. I'm going to move to the second question now, directed particularly at Councilor Arroyo, but please, anyone can also jump in afterwards. So the question is, what are the most significant reforms to policing / funding allocation to welfare programs that are currently being pushed by you and your colleagues at the Boston City Council? And what will the next major steps be / look like?
Good question. So there's a list here because we've been offloading a lot of ideas that we've been in the hopper for a little bit. So the Police Civilian Review Board, we have some, I think it's like a co-op. We've had one, it's ineffective, and it came about this is an old idea, it's not new, but in the 2000s, the early 2000s, it was presented with subpoena powers and with real teeth and with real civilian review aspects to it, and it turned into something that got watered down. And so now there's real push, and you'll see that legislation come out shortly, and I'll be on that, to really strengthen our Police Civilian Review Board. On top of that, we have 3 counselors, Counselor Mejia, Counselor Edwards, and Counselor Wu, and I'll be a co-sponsor on this when I have the opportunity to be, pushing for the creation of a different option, a different resource, whether it's social workers or trauma team workers, to respond to 911 calls. Right now, we don't have that option. We have police, and then we have police. And so the idea is to create a different wing, a different team, a different group of folks to respond to calls like mental health emergencies, calls that deal with addiction and substance abuse, calls that deal with just real needs that illustrate that, you know, we probably don't need to send armed individuals to those situations. And so we're trying to create that now as we speak. There's been other restrictions or things regarding, you know, how they're trained, what their regulations are. I've put forward an ordinance, which is a city law, dealing with tear gas and chemical weapons and kinetic impact projectiles, things like rubber bullets, rubber pepper spray, attempting to essentially make those, if they're ever used, that they meet such specific restrictions that they're actually, if there is such a thing, a time in which that would ever be appropriate. Right now, none of those restrictions, none of those things exist. And so you've seen them used for things as simple as trying to disperse a crowd that is peacefully protesting, right? So they've used chemical weapons and rubber impact bullets just to ask them, or I guess demand of them that they move, right? So these are the kinds of things, both on just personnel, on actual policy and changing things. And then the last one would be funding. Trying to address the ways in which they get money from the city to deal with certain things. Overtime was a major issue because the reality is The budget line, I think in this last year, to put this into context, we spent about $70 million. It's closer to $78 million, frankly, when it's all said and done, in police overtime. That's just police overtime. For reflection, our youth jobs and employment, our youth engagement and employment gets exactly $7.8 million. And so when we talk about the overruns and where they are, that's another thing. When you talk about the money for militarization, that's another thing. And so there's both personnel costs and there's equipment costs and what they get for certain things that, frankly, I'm not sure how necessary any of them are for the city. And so it's multifaceted. It involves money. It involves reforming the responsibilities, and it reforming what they are equipped with and what they're equipped to use, and reforming the regulations under which they operate. And so there's a number of different things going through the pipeline at the moment, dealing with all of those different steps. And I hope that was as thorough as I could be on those things. But I think that we still have a space to really reimagine what policing looks like in the city. You know, when this was all happening, and I've got a couple minutes left, so I'll give you this story, because when we were fighting for the divestment, when we were fighting for that money to go into other communities, I actually spoke to police captains because I was trying to figure out what their viewpoint on these things were. And what I got told all the time was, we have special units. We got bike units, the youth task force unit, otherwise known as the gang unit. We have the drug unit and all these units. And what happens is, in order to get into a unit, you have to get taken out of the district. So the units actually create these shortages at the district level, your local police station. And so that shortage then creates the overtime because they have to take those officers from these specialized units. The other thing that I realized was the biggest police district is West Roxbury in Boston. West Roxbury is incredibly affluent. It has the least amount of officers on duty on any given time at any given day, which shows that there is no direct correlation between having less police in your neighborhoods and having less crime. And so that was something that they just kind of offered up, right? Like, we have the least amount of officers in the largest amount of territory in one of the wealthiest neighborhoods of Boston, and yet there's no increase in crime because of that, which would suggest that police, frankly, neither increase nor decrease crime levels. And so, you know, when you're putting in money, it's also about creating rubrics for what is effective and what isn't for the things that they do. And frankly, when we were going through the budget process, it was really trying to figure out, how do you decide what's an effective method of policing and what's not an effective method of policing internally? And we weren't getting a lot of those answers, right? We weren't getting told, well, if you put $15 million into this and it leads to 3 or 4 arrests, we stop doing that. There was no like actual rubric for what they look at. And so it's pushing for things like that overall. And that's kind of how we're looking at it.
Thank you so much. That was a very informative, Councilor Arroyo. And then next, our question is for Dr. Crawford. So too often we see that police officers are responding to calls where someone may be in a psychiatric crisis, and the police officers are responding with excessive force. Could you comment on how a trained mental health professional may approach the situation differently, and how they may attempt to de-escalate it, and if this would be effective?
Yeah, it's a great question, because it's something that we often see with our patients with psychiatric illness, especially during periods of time in which the severity of their illness interferes with their ability to have good insight as well as good judgment. And so there are times when people are acutely ill and they may exhibit aggressive behavior, may pose a threat to themselves or other people. And given that fact, there are times in which the police are called. What we have been doing in the field of mental health is we have been training our patients, our families, on how to make such phone calls to the police when they have family members who are experiencing acute mental illness, so that they can warn and prepare the police officers for when they are entering into the home, that they're aware that this is someone who is ill. Now, one could say and argue, well, we shouldn't have to train our patients and families to tell police what to do, but it has been done as a result of what continues to happen when these phone calls are made. And so it's one way in which we have tried to minimize the potential risk of making these phone calls for families, because it puts families in a really difficult position. They know that their loved one is ill, they can't manage the behaviors, they're very aggressive, and they may be concerned about their safety and the safety of their loved one, but yet they're nervous or scared or worried about calling the police and what that interaction will look like. We want people to feel comfortable to call police because they do need to be transported to an emergency room in some cases. But we also don't want the families to be struggling alone. One thing that has been happening for many years is something called crisis intervention training, CIT. And there's an organization called NAMI, the National Alliance of Mental Illness, that has been working with law enforcement for a number of years, as well as working with families and individuals with lived experience with psychiatric conditions, on how to have conversations about ways in which to better inform law enforcement so that they are more sensitive to addressing the needs of folks with psychiatric illness in the community, to potentially de-escalate some of these interactions so that they don't always result in aggressive and unnecessary force. In addition to that, we have in Boston something called the BEST team, which is the Boston Emergency Services Team, which is a team of trained clinicians. Most of them are social workers or licensed mental health clinicians, who actually go out into the community, into families and patients' homes to do evaluations, crisis evaluations, to determine whether or not the patient's presentation is at the level in which it warrants a higher level of care, going to the emergency room, or if their behavior warrants a little bit more assistance in the form of police, especially if the patient is somewhat dysregulated. So that is something that's currently in place that we use for our families in the Boston area. They work with children, adults, the elderly population, and the homeless population. So that's a resource that we frequently use. And we also tell our families that they should give them a call first to assess the situation and then call police if need be. But we always have to tell folks if there's an acute safety issue, then we should let the police know. The other thing too that I just want to say briefly is that there are a number of times in which individuals are by themselves out in the community. They may appear dysregulated, and police will approach that individual with unnecessary and excessive force, when what's probably happening is that there might be an underlying mental health issue, or the person may be intoxicated. And so again, with the training, with the CIT training, with law enforcement, so that they approach everyone trying to assess the situation first before just making an assumption, being aggressive, using unnecessary force, especially if we presume that person may have illness.
Thank you so much, Dr. Crawford. The next question would be for Mr. Lindo. So the question is, so many people are calling for the arrest and imprisonment of the officers that killed Tony McDade, George Floyd, Breonna Taylor, while also calling for the abolition of police departments and prisons. So our question is, how do we obtain justice for those murdered while not simultaneously fueling the very system we're trying to dismantle?
Yeah, that's a great question. And it's a question that requires, I think, for us to sit in a number of different spaces. One, in the space that we currently sit in, which is we have an incredibly retaliatory, non-rehabilitative carceral system that has never proven to actually decrease crime. Actually, recidivism in this country is 75%. So by definition, it's ineffective. And so to send someone to jail actually doesn't fix the problem. If you listen to any of my talks, I've never actually encouraged that these folks go to jail for the rest of their lives, because I know that's not actually solving the problem. And so if I were to be true in the analytical approach of abolition, we can call for that. And I would like for there to be a place that those police officers aren't actually around to kill someone in the first place, so that we don't have to have the conversation of deciding whether we send them to jail or not. Unfortunately, we are. So they're here. Now, what do? Well, we can't do a small fix and say, well, maybe those police officers shouldn't go to jail. If that's true, then that means everyone else in the carceral system should also be released, because that's where we'd be coming from that logic. Because what we have is a system where Counselor Ricardo Arroyo, public defender, saw every day that you had a system that was putting Black and brown bodies behind bars, and it wasn't actually getting to the core of the issue. To his point, what we get, if we provided healthcare, housing, education, and a job, I am almost certain that crime would go down nearly 75%. Because much of the crime that exists is because people are trying to survive in an incredibly difficult economic situation. But specifically to the police, again, I don't think putting them in jail is solving the problem. It may, for the family, have a sense of winning, of justice, and saying that justice is served, but that's only because our current system has decided that justice means you go to trial, you get tried. If you lose and you're found guilty, that means justice is served. And I am adamantly opposed to it because it's an inherently flawed system. For me, I think we need to look at models of how do we adjust the carceral system. There's indigenous folks and indigenous tribes here in the Pacific Northwest that if you kill someone, you and your family are indebted to that person's family for 3 generations. You have to take care of their family financially, educationally. You have to make sure that they are sustained and they are taken care of. You start recalibrating how you maneuver through the world and what things you're going to do and what harm you're going to cause when you know that you are now inextricably bound to those you cause harm to. And that's really a motto of restorative justice. What does restorative justice look like in our communities? What does healing look like in our community? Sending someone to jail doesn't mean that they're healed, and it doesn't mean that the folks harmed are healed. Restorative justice means that we're coming together with everyone involved. Imagine if that officer has to sit in the middle of a New York street with hundreds of thousands of people around him, letting him know the harm that he caused. He would likely want to just go to jail, because the effect of having to weigh the community, of breaching the trust of the community, is severe and significant. And it is, and it should be. Abolition is not about moving away from accountability. Abolition is, again, reimagining examples of way that we hold each other accountable, that is in community, that is humanizing. One example that I'm looking at of how do we prevent these things from happening. Right now in Seattle, we've spent nearly $25 million in police lawsuit settlements for police misconduct. Most of that money comes from taxpayer budget, from the general fund. I'm asking the question, why is my taxpayer money going to pay for police officers that are abusing my community? If we want to change how these things work, then let's change the way that, to council members' proposal, change how we fund these things, right? It's not an all or nothing. I'm perfectly fine with getting changes. And I'm sure if we ask the council member, do you believe that Professor Lindo's approaches are too radical? The truth is that unless we show where the post is, our elected officials don't know how far they can go. And it is a relationship that we say, this is how far we'd like you to go. And what I'm hearing right now, I love the fact that they're talking about defunding, how they're talking about reallocating, looking at different ways to police, to get into communities for public safety. But my goal will continue and always be abolition. But I'm not going to bite the hand and say, well, I don't appreciate anyone here because they're not abolitionists. That's not how this works. We're talking about building humanity among communities. And so that's what I would have for these folks, is how do we build community that builds humanity through a restorative approach of bringing folks whole.
Thank you so much, Professor Linder. That was very, very informative. So now I think we'll be able to transition into the audience section of the webinar, where the audience is able to ask their questions in the Q&A box. And we'll have some of my classmates, Norma Hilton and Shayo Wijay, who will be reading out those questions to the panelists.
All right. Thank you so much, Terrence. And thanks so much to all the panelists here. This has been such a great discussion so far. So we have a bunch of audience questions coming in. And we just ask that panelists try and keep it brief so we can get to as many questions as possible. To tell you a little bit about myself, I am a first year, well, now rising second year student at Harvard Medical School, an MD PhD student, and I am on the board of SNMA as the Community Service Chair. So the first question that we have for our panelists comes from Sylvia, and she's wondering, could anyone please comment on the value of implicit bias tests? How do we use the results? How do we translate the results into action? Thank you.
Well, take a quick stab, and Dr. Crawford, if you want to talk about it as well. But you know, the data shows that it has flaws, right? If you take it multiple times, folks get conditioned to the examination or to the test, and they can adjust for their biases. I think as a premise, it's a good start for us to understand what our inherent biases are. Super helpful. But we need to start talking about racism and justice. Because for me, implicit bias is the act of racism, but it's couched in this term that feels much better to talk about, but we're not actually addressing the issue. And so we should be called the racism test. How racially biased are you? And let's look at that. And how do we get to systems or to practices that address those things? And there's different ways of doing it. And it's not talks, to be honest. It's not because we sat in a lecture hall and listened to a workshop. That's not going to change people's hearts. It's going to be because people are actually engaging among themselves with these difficult topics of deconstructing whiteness, deconstructing white supremacy. That takes a lot of work.
Yes, and I'll just add, when it comes to implicit biases, the way that I like to think about it is that it is one of the factors that continues to reinforce structural racism, because all of these different policies and practices that have been put in place to oppress and marginalize Black people has resulted in a number of disparities and inequitable outcomes. And because of that, people have been primed to make these assumptions based on about Black people due to the effects of structural racism that makes them biased in such a way that they don't even realize that they are, because of what they're seeing in the media, what they're seeing in their environment. It just reinforces these images, these stereotypes of Black people, but it's all because of structural racism. And so implicit bias is what allows these practices to continue decade after decade after decade, and people don't even realize it, right? That they are in Congress, that they're in the Senate, wherever they are, and they're executing these policies, but they're informed by their implicit biases. Same thing we see in medicine. We see it in the way in which we're taught about certain conditions and disorders. And it reinforces that, especially, here's an example that you guys can relate to. In different case vignettes, they always like to use race in the one-liner of the case vignette, and it's usually not even relevant to the medical issue that's being discussed about. And oftentimes, if it is a Black individual who's being used in the case vignette, it's usually or substance use disorder, or they have a number of other conditions, and so HIV, what have you. And so we need for folks to be aware that this is a thing that does exist, implicit biases, that it has reinforced structural racism, but taking the test, going on the website, it's just a start, but it's not a cure-all. It's just a tip, teeny tiny tip of the iceberg.
Absolutely. Thank you, Dr. Crawford and President Lindo for the responses. Everybody, my name is Shayo. I am a rising second year, also in the MD-PhD program at HMS, and also on the board of SNMA. I'm going to be saying our next question from Christina, and also we combined the next question from Raquel. And so the question is speaking on proposed police reform agendas and noting that there's not much agreement among what the most pressing issues are in different cities. And they're asking, how would you recommend bubbling up the most efficient solutions to have them more implemented more ubiquitously across the country? And secondly, do you have any recommendations on how to create the right level of visibility so that the public could really understand how effective these changes are and how they're being implemented?
I'm happy to jump in a little bit on this. You know, I think Edwin kind of spoke about this. The outside direct action is the fuel, is the gasoline that folks on the inside need to make changes happen. And so what happened really quickly with, you know, and I'll use a separate but related thing, right? Medicare for all in 2016 and that presidential race was like a radical notion, right? For most mainstream folks. You get to 2020, 2019, and all of a sudden it's like a requirement, right? Like all of a sudden it's a question that everybody has to be asked, and you have to have a position on it, and you got to talk about it. When we talk about national conversations, and we've seen this before, we've seen this with Occupy Wall Street, we've seen this with the you know, the very first times when Black Lives Matter and Ferguson was kind of exerting its political power. When you change conversations, you are influencing all kinds of things. And so when we started to talk about defunding police, and then people got into a debate about what defunding meant and reprioritization and all that. But the reality is now it's a conversation. Now we're having those conversations, and none of this is new, right? Angela Davis was speaking on these things. None of these things are new, but now they're in the mainstream. And so when we talk about how do we bring out all of these different reforms, right? I think what I know innately is that, and I'll use one quick example on this. When we talk about training, like we could train our way out of racism, I don't believe in that. I don't structurally believe in that. I wouldn't put $1 into that. And the argument that I've used for folks is, if an officer knows not to harass white children, not to put his hands in white children's pockets, not to beat or brutalize a white child, not to immediately criminalize a white child, what amount of training do you think I'm supposed to invest for him to understand that the thing he does for white children, he should also be doing for Black and brown children? I would say 0, because he shouldn't have a badge. And so from that standpoint, those kinds of initiatives, those kinds of pushes, they're easy. They're easy things to do and say, and they actually lead to more funding for police departments, right? And so when we talk about training and all these different things, I'm much more into dealing with root systemic issues. And the fact of the matter is, training isn't going to eliminate racist police officers. It's not going to eliminate overstepping of power and boundaries. It's not going to do those things. We know it doesn't do those things. And so from a national perspective, I'm deeply grateful for all of the organizations that have really amplified together the conversations we've had about funding. I think the way that this stuff works, to be perfectly honest to you, is not like I, as an elected official, direct these organizations into the conversations that they have. They usually set the table, and most of these ideas aren't new. And so if you want to take part in kind of figuring out how to direct these conversations, or if you have solutions or you want solutions amplified, a lot of these organizations are super easy to reach. A lot of them are super welcoming of folks' voices and bringing them to the table to amplify things and to strategize. You would be shocked, just like if you go to a local campaign. If you walked into my campaign office on any given day, you're going to run into me, and you're going to run into like 1 or 2 other people who are deeply motivated by my election and by my campaign. And so when you go into a lot of these rooms, you're going to meet the people who run these programs. You're going to meet the folks who make them go. And it's very easy to become involved and to be given these positions of influence really quickly. And so I think it's one of those things where you have to kind of move in those spaces and have them work. City Life, this might be somewhere where Lady can speak to this, right? Because they did a lot of synergy, and it's one of the ways in which a lot of this stuff works. It's an important question. The one thing I would say is direct action always gets the goods. This system will not reform itself just because it wants to. It will not do that. It does not want to. And so when we talk about how that looks and what that means, it means folks stepping up into their power, walking in their power, and making those demands. And so if you need any help from me on anything on that front, it's just that direct action, direct amplification always works. It is so important. It means a lot. It changes everything. And for your folks that are fighting for those things already, it provides them the gasoline they need to do that. For folks that are dragging their steps on that, they hear that noise much quicker than you think. They recognize that every city councilor, every elected official recognizes that their power is given to them through elections, given to them by people. And it's easy to get distance from that until they're knocking on your doors, standing in your streets and yelling at your house, right? And so from that standpoint, it's the most important thing anybody could do to effectuate change.
And a quick,
I just wanted to add a quick, since you referenced City Life. City Life is about systemic change because that's our analysis also. You know, the shift in power, direct action is a way in which as a community we can exercise power, but the solution to this is to shift power. Police violence and housing violence are both modalities of control. And that is, you know, it just gets down to systemic racism. Dr. Crawford mentioned that the police approaching a dysregulated individual. Well, if they're approaching a dysregulated individual in my neighborhood who looks like me, they're looking at controlling a threat as opposed to assisting someone. So thanks.
Yeah, I was just going to follow up on something that Councilor Arroyo mentioned, and thinking about the fact that a lot of these ideas aren't new. For example, the idea of police abolition isn't a new idea. It's really just an idea that's come to the forefront in recent weeks, given the recent events. And to follow up with the audience question, can you guys speak towards how police abolition and defunding the police relate to one another, and what that could look like, both to Councilor Arroyo and the rest of the panelists?
So I'll just touch this for what it means for me. So I believe in my heart, truly, it's a guiding principle for me. I believe, I was a public defender, I saw it up close. If my clients were given opportunities, if they were given treatment, if they were given a pathway out, I talked about this a lot on the campaign. When I was a public defender, I had over 500 cases. So that's 500 different clients that I interacted with. I never met a single client who was involved in any criminal activity or what we define as criminal activity that wanted to continue in that way. It was not really an option for my impoverished and homeless residents to not trespass and sleep in a U-Haul van, right? They didn't have a place to stay. For my folks who were battling addiction and couldn't find a bed, right? And so they wanted a bed. I can't tell you the number of clients I had who said, can I get a treatment center? Can I get a treatment center? And they had to go to a jail for 2 to 3 months before a treatment center opened up. I can't tell you the number of people I had who had mental health illness who were essentially getting recycled through the system, where it was like, look, we know that this person's needs are permanent, but we're not going to provide them the permanent assistance they need. We'll kind of stabilize them and set them loose and see what happens, and then we'll stabilize them again and set them loose. And there was that constant lack of following through and figuring it out. If I had resources, and I believe this in my heart, to this day, I'll go to my deathbed believing this. If we fund these things, if we fund opportunity, if we fund educations, if we fund treatment, if we give people the lives they deserve, you won't need police at the level or the rate that you need them right now. That's just not going to happen. So for me, the way they're connected is if you take the funding that we give police and you do it in the things that actually treat the causes, the root causes, because this is another really important thing that folks need to understand. Police do not solve crime. Hiring more police, you do not jail your way out of these issues. You do not fix any of these issues through incarceration or through policing. You fix them through all of the other ways in which we've already identified and the data's already shown: treatment, opportunity, funding, for all these different things. If you fund all those things the way they should be, there will be less symptoms of the issues that happen when you don't do that. And my belief is, and I think this is a general belief, if you do that, if that works, if we are right, if that works, you will need less officers, which by its nature leads to a level of abolition in a sense, because there's less need for police. police. So there's less hiring of police. There's less maintenance of police structures because we're actually taking care of the root causes of it. And so for me, that's how they're connected. I would not say at this time that I'm an abolitionist. I'm still learning and researching and getting into, comfortable with what that means and what that looks like. I'm certainly a proponent for what we do right now does not work. I'm aware that our carceral systems don't work, that we don't have, if you ask most people, if we have 237 attendees, if I ask them, is our prison system supposed to rehabilitate or punish? You would likely lead to very different answers. And the reality is the system itself doesn't know what it's supposed to do. And you can't do both. And so at the end of the day, there's no rehabilitation to the level that needs to occur. The resources there don't do that. And so when we talk about this system as a whole, what I could tell you is what we do now does not work. Can I see models and imagine models that work that don't include the things we do now, the over-policing, the over-incarceration? Absolutely. And so for me, that's where I stand with abolition to defunding. And I think that when people talk about defunding, when you say defund something, it sort of sounds like cuts just for the sake of cuts. But what we're actually talking about specifically is a redirection of that money into things that actually cause public safety. These are public safety things. Health, wellness, employment, education are public safety issues as opposed to public security issues. And those are completely different things for me.
And to quickly jump on Councilor Ricardo, and I'll be quick here, is he's absolutely right. I mean, the way I see it is defunding, moving towards defunding is moving towards abolition, right? That's the direction that it's going. And the other truth is that there's many people in this country right now that are living an abolitionist lifestyle. They don't have police roaming their streets. They don't have cop cars with lights on in the middle of the night. They have gated communities with gates. The police can't even come in unless someone calls them. There are communities already that are living without police. Why? Because they have everything that was just mentioned. Housing, education, food, every resource they need, they have. And guess what? They need less police because the necessities are there. So this idea isn't a wild kind of practice of comic book writing. It's folks are already living it. They're just not telling us. They're like, no. Yeah, I'm good where I am. I just don't need, I don't want you to have less police because I'm concerned about your neighborhood. Because if something happens there and they come to my neighborhood, then I need more police. And I get upset about that because when more police come, my property value goes down. And I don't want that. So now we're talking about economics, right? And so the economics play a role here in that really policing is relatively new apparatus. It's a mechanism as a police state started in Boston. 1838 was the first police department in these United States. And their sole purpose was to protect the property of the ships that came to the ports. Because the ship owners didn't want to pay for private security. They said, let's get our taxpayers to pay for our property protection. Their sole purpose was to protect property. And if we look at it today, that's the exact same purpose. When we go march for Black Lives Matter, they're looking at us protecting the buildings. When white folks are going with AR-15s to state capitals, they're making sure they can get in there safely. So the question is, what property are they protecting? Is it the property of white freedom and the property of buildings? And what part of that equation is it Black and brown bodies that are getting protected for the liberties that we're so-called having?
Can I touch on one thing that Edwin just said is super important really quickly? Edwin brought up the idea that, in these communities, which is true, there's multiple suburbs in a neighborhood near you that invest much less in policing and in that. What I would also make really clear is those communities also differ. It's not that they don't have addiction. It's not that they don't have these kinds of things. They just don't believe that the way to cure that for their own communities, for their own children, is jail and incarceration and prison. They just don't believe that. They don't practice that. They don't do that. And I think you've seen a very national stance when we were talking about cocaine and crack cocaine and sentencing disparities and a war on drugs. I think the whole country saw a real change in that when we started to talk about opiate addiction and really what heroin and all of these different things were doing through white communities. It became a medical issue and not a criminal issue. And I witnessed that in courts every day. And the reality is there's a racial implicit bias, call it what you want to call it, when it's Black and brown communities and white communities, they can look at the same problem and disagree in the way that it should be solved for each one. And so the reality is, in those communities, they understand restorative justice. They understand the idea of rehabilitation and the idea of treatment of mental health and of addiction issues. And they don't use those same rubrics that they are enforcing on communities of color on their own communities. They don't say to themselves the correct way and the only way to deal with addiction is prison or arrest or this carceral state. The correct way to deal with mental illness is carceration or arrest. And so when we talk about these issues, there is a racial undertone and undercurrent to the fact that in predominantly white communities that have wealth and the ability to deal with these issues, they don't come to the same conclusions that they're imposing on communities of color. And so I think it's important to understand that it's not that they don't see addiction or mental health or experience any of those things. They just don't use the same solutions which they propose to our communities to deal with that. And I think that's incredibly important to recognize, that it's not that they're crime-free in that sense or that they don't have these experiences. They just don't believe incarceration or policing them is the way to deal with them. And that's important to recognize and realize.
Mm-hmm. I just want to quickly jump in here because we've been talking a lot about mental health. Is that what we do know to be true is that the majority of Black people, especially Black men, who have psychiatric conditions receive their psychiatric care through the criminal justice system. The majority of Black men receive their psychiatric care through the criminal justice system. What I have noticed during my experience working in a Nashua Street Jail here in Boston is that a number of the 18-year-olds and the young adults who are in prison, a number of them had psychiatric illness secondary to trauma that they experienced early in childhood. And they had pretty significant illness throughout elementary school, middle school, and high school, and never received treatment for it. And it has to do with a number of reasons. Number one, there's a huge stigma when it comes to mental health in the Black community. And so parents, caregivers were probably aware of the issues, the fact that the kid had a number of behavioral disturbances, emotional disturbances, however, felt like the kid didn't need to receive psychiatric care. So I just want to put that out there, that I'm concerned that some of the barriers that get in the way of being able to address some of these broader topics that we're talking about is the issue of stigma getting in the way of young people and even adults from seeking out the care that they need. So we can reallocate all of the resources in the world towards mental health, but it isn't until when people actually value the mental health and emotional well-being of themselves and other people within their community and advocate for them to seek out treatment and to get the help, and for them, if they're going through something, for them to get the help that they need and to share that experience with other people. Folks are going to suffer in silence. Folks are going to result in unfortunate situations in which that lands them in the criminal justice system. So I just want to put in a plug about the importance of addressing mental health stigma to also address this situation that we're talking about.
I want to just quickly add on to that. Personally, for me, it was difficult to say publicly that I have PTSD and other psychiatric issues. And that's internal to our community. On the other hand, there's also the fact that the approach, as in Dr. Crawford's example earlier about a dysregulated individual, when systemic racism, the violence that comes from looking at us as a threat is another part which is external to our community, and those two play together, the interplay. And then speaking to defund the police, I really want to just kind of get real for a second here. There are parts of the police budget where they took the money and just burned it in a bonfire. People in my community would be safer. For example, that racist database, for which there's been some litigation over. So defunding can be removing some of the dangers, some of the military hardware that they don't need. It can mean getting rid of that racist database. And it can also mean funding the things that we do need, which is if you have a home, if you have healthcare, you have, including mental health care, you get different outcomes. Because as Councilor Arroyo said, people in wealthier neighborhoods use drugs. They just don't have to struggle as hard to get the drugs, and they have the resources to buffer themselves. But thank you.
All right. Thank you so much. This has been such an exciting conversation. I hate to jump in and jump to the next question, but just given the time and the fact that we might not be able to get to all questions, I'd like for us to sort of shift the conversation a little bit to something that Dr. Crawford actually just brought up, which is speaking a little bit to how can we change or implement change in the medical curriculum. What changes do you recommend in higher education to address the unique challenges that people of color are experiencing as a result of the level of trauma, so that we have better trained medical professionals in the future? And then I think more broadly in terms of medical curriculum, we've been getting a ton of questions around anti-racism practices in the medical curriculum more generally, whether at the level of practicing physicians or within medical training for students.
Yeah, so I'll speak to that. At Boston University School of Medicine, over the past year, medical students have examined the preclinical and clinical curriculum extensively with a microscope to understand how it is that faculty are addressing issues regarding racism. And they have developed an extensive report that is full of suggestions for every single course that medical students go through throughout their 4 years on how they can make improvements, recommendations that they have to better address racism, structural racism. And so in response to your question, I think there needs to be a commitment from the medical school to examine their curricula to see if they are being intentional in addressing this issue and how it affects us or you guys as future medical students and how it impacts the type of care that you provide to your patients. And it helps to better inform you all of what the patient experience is like, given this world that they've been exposed to, in which they are constantly bombarded by the trauma and stress related to racism. And so it's not just a one-day workshop on cultural humility or a slide on health disparities or a Black faculty, chit-chatting with you for an hour, right? It's a lot more than those things. And it can't just be on the shoulders of the Black faculty that you have. It has to be across the entire institution. Every faculty, leadership, administration should be invested in this, and it shouldn't just rely on the shoulders of Black faculty and Black students, quite frankly. So I think it needs a comprehensive overhaul, because we've been practicing and teaching medicine for the same way for a long time. And given all the momentum and all the conversations now, finally folks are interested in change. I don't know what took so long. It's unfortunate that it took a Black man being under someone's knee for almost 9 minutes for people to start, caring about this issue. But at any rate, there's momentum now. And so if there's a way to talk to administration leadership to do a comprehensive overhaul, I think that's the only way we can really move forward in addressing racism within medicine.
Yeah, I want to second all of that. I think that's absolutely right, to have a complete overhaul of the undergraduate medical education that starts with examining your blocks, examining the material that's brought up, examining the syllabi. Now the difficulty here, right, and Dr. Crawford mentioned students, is that this oftentimes falls in the backs of students to carry the load of examining all this material. And so it's also encouraging the institution to say, can we get faculty who are dedicated to this work, right? So that I can actually come to med school and just learn about medicine. While y'all are doing this work, I'm happy to provide guidance for that because I want it to be done in a way that I know is reflective of my experience. But what I've seen though is there's some institutions that will just drop it on the students, and it becomes quite a bit of work. And it hurts to see that because I don't like to do free labor. I know our students don't like to do free labor. And so there's a relationship there of, let's do this work because it's for the good of those students coming in. And also, I think we have to imagine, how do we center a pedagogy that's focused on justice? Having been in medical education for a bit, there isn't a set pedagogy, right? The pedagogy is, you have this exam called step 1, you have step 2, we're going to teach you for those exams, and you're going to get ready for it. That's not a pedagogy, that's teaching for an exam. Pedagogy means that we're actually engaging students in a way that's dialectical, that they're contributing to the learning. They're also the teachers. We're in facilitation of learning this material. And so I want to give a big shout out to the students at the University of Washington School of Medicine, because they push, and it's beautiful to see the organizing that's taking place, and the number of changes that you may have heard about at UW come at the hands of the students. They come at the hands of the students that are saying, this has to be different. I started a course called Critical Race Theory in Medicine. That's an elective, right? It's imagining what opportunities are there, but a mandatory course where the material professionalism or QI or ethics actually is funneled through a discussion of justice. Imagine your ethics cases through a justice lens, instead of it just being ethics. I think there's an opportunity and something exciting there. But yeah, build relationships and coalitions with faculty, with other students, other schools, and really it's organizing. It's organizing like we're talking around policing. It's organizing communities with a similar interest to make a fundamental change that I think is important. The last point is history. Know how medical education came to be. If you haven't read the Flexner Report, then I need you to read the Flexner Report. It came around in the 1900s that really laid out why we have medical education the way we do. And it's unfortunately grounded in economics and capitalism. How do we deconstruct that so you can actually get a more humanistic form of learning in medical school?
Just a quick add-on to that. I met Terrence through his class coming to City Life. And if you really, the concept of expertise, the people who are really going to understand racism is not somebody who went to MIT, Stanford, et cetera, and has a PhD. There is no substitute for actually having the lived experience to knowing what you're talking about. Okay, so there was a course that Hannah invited us to at Harvard where they were speaking to the actual, history of what's happening with displacement, and that kind of engagement with outside of the classroom, I think is going to be very educative.
Okay, thank you all. So we're gonna go to the next question, a little bit of a shift in topic. So Courtney asked about the use of eminent domain and in the fact that it's been used to take away landed resources from Black farmers and Black towns historically. And could you all speak to the possibility of using a similar style power of eminent domain to instead be used to create land trusts, cooperative housing, cooperative urban gardens, cooperative health justice spaces, et cetera, and other community resources for Black and Brown communities? I think that touches a little bit on the idea of creating affordable housing and also thinking about reforms at a more systemic level. So anyone feel free to answer.
I'd like to take a first stab at that because actually we have in Boston through civil rights structure, Chuck Turner and other Black leaders in the community mobilizing political power. We actually have one of the few examples where there's a community land trust that had eminent domain as an authority. So when, basically eminent domain allows the government to just take property. And usually when that happens, it's more powerful people taking it from our community. So it's definitely a tool that needs to be used. It underlines, the whole concept of rent control. When people oppose that, and then they say that, this is, but the same people will not oppose the use of eminent domain so that they can acquire a parcel that's needed for a commercial development. So that, giving that power though, this is where it gets back to that concept of those most affected must lead. If the community in which the land is being controlled by that community instead of outside developers, you get very different decisions. So we have the Dudley Square Neighborhood Initiative, which was the result of the mobilization of Black Power in Boston, but that's the exception, and we need to make that the norm. I just want to leave time for others to comment, but.
If there are no other comments, we can move on to the next question. So we have another question coming in that asks, do we think as long as we have a capitalist society, as long as capitalism exists, can we ever have a society that's not truly racist? In other words, do you believe that as long as capitalism and its systems exist, so will racism? Is socialism the answer?
So I'll take a stab at this
Yeah.
because
Go ahead, add on.
I don't think capitalism is the cause of racism, right? And so the reality is the United States as a country and how it formed its systems and how it created sort of a hierarchy based on race and did all of these different things, and the enslavement of African American people or African people and then African Americans because they were born here, and the indigenous. They've created sort of a system based on racial hierarchy, also based on patriarchy. And I think that the system that they use to kind of fund and create this country is capitalism. That's what we still use now. And capitalism certainly can wield itself in a racist manner and does on a regular basis. But I don't think that I think you can have racism in a socialist country. I think you can have racism in a communist country, right? Those are economic structures that change so many different aspects of how society works, but so central to American society in our governing principles, in our governing documents, in our Constitution, in our bills of rights, in our state constitutions. Race was a dividing factor. Race was a system set up to create sort of these hierarchies and these problems we have now. And we've never addressed it. We've never really fixed it. And I think capitalism has certainly taken advantage of those things. And really, because of the way America was set up, if we talk about economically, if we talk about GI bills or anything that the government has done to create wealth within its capitalist structure, and in the ways in which they've excluded people of color, generally speaking, you are going to see in this country less success for Black and Latino and people of color in capitalist structures because those structures weren't built to include them. But that reality to me does not separate the fact that racism and those racial hierarchies operate in this country separate and apart from their economic institutions, separate and apart from the way that they decide to generate income or run their society. It's a central figure to their society. And so to answer the question, which I think had something to do with, is socialism sort of the answer to racism? I certainly think that there are aspects of socialism, and I'm a democratic socialist. I think there are aspects to socialism that alleviate some of those harms. But I don't think that if we became a socialist country tomorrow, that would somehow eliminate racism, if that's a clear answer to that.
And I just wanted to add on to that in terms of capitalism in this country, it was built, basically the country it's stolen land, and then it was built, the economic, wealth of the nation was built on the backs of stolen labor. Pre-Civil War, the state of Mississippi had the out of the European nations, it was the fourth largest economy, that one slave state. So if you look at the accumulation of wealth that fed our industrial revolution, there's a book, The Half Has Never Been Told. It's a very interesting economic history. There is a direct correlation between the economics of slavery. As a matter of fact, I was recently reading that Southern states entered the revolution, because they were afraid that Britain might take away their slave property. But fast forward to where we are now, the one thing about socialism is that the biggest problems that we have here with capitalism are private wealth versus human lives. And again, we see it with this pandemic, decisions being made which are costing our lives because somebody is worried about the rolling average of the S&P 500 instead of maintaining public safety in this pandemic. So to the extent that socialism will put people first and will accept housing, health, et cetera, as a human right, and then assume that they must be provided, then that's going to address a large part of what happens with racism. But you still have to get, as Councilor Arroyo said, we still have to see Black people as equally human to white people, because it won't go away by itself.
I'll also quickly add, so I want to separate the question because I think it may be a question that gets to an answer that isn't an answer to the question it asks, which is socialism the answer? And I don't know if that's the answer to the question of can you eliminate racism, right? Because we have to sit in the truth that capitalism requires, for it to operate as it suggests, and you can ask Milton Friedman, who is many people see as the neoliberal father of capitalism, would suggest that you have to have poor people for capitalism to operate. And the truth is, you have to, like, if there's no poor people, then there isn't an incredibly high concentration of wealth on the top. Because there's a finite amount of money in, at least within the United States. Well, to create that huge disparity, racism has been used as the mechanism to ensure that there is a very discrete group of people that stay poor. And so, but it isn't just racism, right? You have cissexism, you have sexism, you have xenophobia. These are elements that uphold capitalism, that uphold it to maintain so that it can survive and actually reiterate in ways that some people never imagined that it could. The funny thing is that you look at our current state during world pandemic, and this country is relying on socialist policies to survive. We're talking about universal income. We're talking about providing healthcare to folks. We're talking about make sure that they can get access to housing. 3 months ago, people would have thought that's crazy. Now it's the only way that this country can actually survive before it loses its bearings. And then the last point I'll make about this is that in many ways, the incredibly wealthy folks embrace socialism, right? They socialize the losses of their companies, but will privatize the profits when they make money, right? So it's a pick and choose situation within this country. And I think we have to hone in and do a strong analysis of the economic system. But I do think that racism is a mechanism of capitalism. It doesn't necessarily mean that socialism will solve it. I think we have to imagine even a new economic model that hasn't been described yet.
All right, thank you so much for that. And sort of connected to the idea of racism being used as a tool of capitalism, one example of that is the school-to-prison pipeline. And we had a question about asking about the school-to-prison pipeline and how to disrupt it, commenting that wrongly jailed and incarcerated individuals have had inadequate legal representation as part of the problem, and we don't trust the justice system. And related to that, we also wanted to ask another question from Francesca, who was wondering from both Dr. Crawford and to all, she wanted to hear more about how children and teens navigate sort of the pain and the fear and the rage that's been going on lately, and what effects that could have on mental health. And are there any resources out there for parents who are trying to like educate their children or help them deal with these feelings?
Yeah, I'll address that last question. It's a really important one. What we notice is that when it comes to what's happening in our country right now, and the conversations that kids are having, and the conversations that they're bringing up with parents, as Edwin had mentioned earlier on at this talk, are absolutely heartbreaking and just so incredibly sad and disheartening to hear that children as young as 2 3 are asking these questions and having concerns about the health and well-being of their caregivers in this current social political climate that we're in right now. And that's just not okay. It is not okay for someone under the age at 5 to worry that when they see a police car that they're coming after their daddy. That's not okay. And the fact that we're living in a society in which these questions are popping up and we have to develop resources for how parents navigate this is crazy. I'm just going to say that for the record. And we need to acknowledge that the fact that we have to have this conversation is ridiculous, and to have it within the Black community, and it's a common conversation that is held in the Black community, is just really unfortunate. So what we do know is that there have been some studies that have demonstrated that children who experience vicarious racism, so a racist incident that happened to someone that they know, someone that they're close to, and even in some cases, a stranger that they may know, we know that when they're experienced that, when they're exposed to that and they hear a story about a racist incident, we see an increase in depressive symptoms. We see an increase in some behavioral symptoms in which kids are a little bit more clingy. They engage in some regressive behaviors such as bedwetting and acting out more. They may become more socially withdrawn and isolated. These are things that happen when they hear about these incidents or when they happen to someone that they know. And they accumulate over time. I had already talked about earlier about the ACEs, the adverse childhood experiences, and how racism is one of the adversity measures. So we have racism. On top of that, kids have vicarious racism that they have to experience, their own individually mediated racism that they experience, and microaggressions. Like, that's something we haven't even talked about because everything's so macro, right? It's just so blatantly out there and explicit now, right? And so what we do, we work with the kids to acknowledge and validate their experience, to recognize that the fear that they have of when their loved one goes to work and how they feel nervous about whether or not their loved one's going to come home, we need to validate that and say that's a very real fear, and you're not being unrational for having that fear, because it has been reinforced by what we hear in the media time and time again, and what we see in our own communities. On top of that, we need to invite parents to be open and willing to have these conversations, and not just Black parents, but white parents too, for them to acknowledge the fact that this has been happening to children in their classroom, to children in their communities, and this is a part of the Black experience. And that's part of addressing the privilege that some of the white people have. Parents need to inform their white children that this is a reality for the Black experience. So we talk a lot about resources for Black families, Black parents, but I think it's as important to talk about things that white families can do too, to talk to their kids about this. So I'm a huge proponent of NAMI. I've been a volunteer for quite some time. And on their website, if you go right to the home page, there's a banner talking about racism. If you click on it, there's a whole list of resources that are available talking about how to address racism for families, for children, for individuals. But I think the short answer here is to have the conversation, to validate the experience that the kids are having. When they question, I don't know, that teacher, they said this to me, I'm not quite sure what that was all about, to just call it out and to name and label racism when it comes up so that kids aren't second guessing themselves. And I think that's something that we can continue to do with our young people, so they're not having that second guessing that I had alluded to earlier.
Great, thank you. So we have just one final question that we'll address now, and hoping everybody can jump in and share thoughts on this. And the question is, what can individuals do to act to promote racial justice in their own lives? And then sort of following up on what Dr. Crawford has just brought up is, what is the role of white allyship?
I'll go first on this one, and I'm just gonna pop my information into the chat for everybody who's attending or a panelist, because if you want to engage on an idea that you have or an issue you have, please reach out to me personally on those things. As an elected official, it's kind of my best thing I can do. But what I would say is individually, every person has power. You know, I brought up earlier about how do we reform, you know, these institutions, these medical curriculums. I was in law school at one point, and I could count the amount of other Latinos and Latinas on one hand, right? There was like 10 of us total when you put us all together between each level of 3 years of law school. And it didn't seem like a lot, but whenever we combined our powers, we were incredibly powerful to these white institutions because we were their Latinx group of folks. And so if we were outspoken on an issue, they knew they had to correct that. And I think one of the things that folks forget is on a local basic level, on your everyday life, and whether you have children in school and there's something that you're seeing that schools are doing or not doing, or the park and the way that the park operates, or just things that are happening in the policing, things that are happening on a basic level, your engagement is incredibly empowering. An email to a local counselor, I can tell you right now, I get like 5 to 10 a day. When we started to talk about politically moving our funding from policing into these other things, I was getting thousands of emails a day. To put that into context, that flooded our inboxes. We had to figure out a way to actually work around that so that we could look at our emails. But imagine the power of just sending an email. Like, sending an email is incredibly powerful, incredibly simple. Making sure that you're changing the conversation, that you're forcing the conversation to stay on point, right? One of the things that I think is different in this moment in time when we talk about racism is, you know, I've compared this to Sandy Hook for white allies and white accomplices who care a lot about gun regulation. After Sandy Hook, they were done with thoughts and prayers, right? Like, you couldn't tell me nothing about no thoughts and prayers. You keep thoughts and prayers. We want regulation. We want policy. When it comes to racial justice, we have gotten thoughts and prayers and conversations for generations and I don't know how many conversations the city has had on race. I don't care about conversations on race. I want policy and regulation, and I want these things fixed and reformed. And so at a certain point, you have the power to say what your demand is. And you have the power to ensure that we as elected officials in your systems meet those demands, what those demands are, right? You're not asking for a conversation, you're asking for changes. So if they're offering conversations, you should push them towards those changes. And I think that the reality is, for white accomplices and allies, just on this specific aspect, you have access to rooms that we aren't invited into. You have access to rooms in which our messaging does not permeate because they don't listen to our media or our Twitter handles or any of the things that inform you. They're not reading our books, right? For you in those spaces, it's incredibly important that you be loud, which for most folks is uncomfortable. And what I tell folks in this situation is, if something feels easy to you, like changing a profile picture or making a status or a hashtag, then do what feels hard. Whatever it is that feels hard, do that. If what feels hard to you is to tell your boss, hey, I've been noticing that when other people of color in this office are speaking up, you don't acknowledge their ideas, or you don't give them, or for instance, something that's true to the system, and I'll leave it at this so I don't take up everybody's time. When we have pay differences in the city of Boston, when you notice pay differences and things like that for people of color who do equal work or more work, speak up on that. Use your access and your privilege to speak on issues that are relevant to your life, where you are right now, that you see every day. That goes a lot further. For instance, I think that's a true act of solidarity for me that goes further than, say, changing a profile picture or saying the right things in public. You know, we've had elected officials who would say a lot of right things in public, but their actions, you know, I don't believe what you say because I see what you do. And so, in other words, just kind of push your model to be as interactive and direct in action as you can. And if there's a level that you're comfortable with, push a little bit beyond that. And eventually, I think we get further that way.
Lady, I think you're on mute.
Thank you. Okay, so quick and practical. There is an organization called Show Up for Racial Justice. And it's basically, you can Google it, Show Up for Racial Justice. So for a white person who wants, that's a great starting place. Another organization in Boston is the Boston Ujima Project. So go to both of them. And that's not to say that they're the only two, but those are two that I know personally, that both of them are going to be a place where you can find the coaching and the opportunity to learn how to respectfully and effectively, be an ally and do something about racism. And I liked what Councilor Arroyo said. If it's comfortable, then you're not doing it, because it shouldn't be comfortable. Last recommendation, there's a book, White Fragility, that some of my white friends have read, and they said that that's been very helpful to them. I'll leave time for others.
Yeah, real quick, I think folks covered it. There's books out there, there's things you can learn online, you can watch the different panels that are virtual. I did want to not leave the question about the school to prison pipeline untouched, because that's work you can do, right? The work you can do is learn about the history of this country, because it will motivate you to move. For example, yes, the carceral system is inextricably bound to the capitalist nature of our country in the ways that many of us may not even be aware. The truth of that is, you look at the 13th Amendment. Many of you may be aware of it, maybe from 5th grade, maybe 8th grade. We didn't read it closely enough. The 13th Amendment says slavery shall be abolished except, there's a conditional statement here, except if you are duly convicted of a crime. That means the 2 million people sitting in prison right now are property of the states. That means we are okay with slaves within the borders of the United States, and we're doing nothing about it. I'm not saying there aren't people doing something. I'm saying the folks here, we could do more. Some ideas on that is how do we stop that? What do we do? Well, imagine if the city of Boston decided to pass legislation that said we won't issue any business licenses to someone who uses prison labor, Starbucks, or any other major Fortune 500 company that's out there. We're talking about they're paying them 40 to 90 cents a day. That's wild to me. And it starts in 2nd grade. There's data that shows us that private prisons determine their growth by looking at 2nd grade reading levels, depending on the zip codes that individuals are from, predominantly Black and brown individuals. So that means the economic model, which is dependent in private prisons on filling the beds, needs more people to fill the beds. So they're looking at 2nd grade reading levels, deciding, well, it looks like these folks ain't gonna make it, so we need to build more prisons. That is terrifying, and it's something that we need to do, and we need to completely disrupt.
And I just want to say really quickly that things that all of us can do is, number one, to take care of ourselves, to take care of our own emotional wellness. Hearing these stories, reading the newspaper articles, seeing these images on TV continues to chip away at our core. And you all, as medical students, already are under so much stress. But to be doing medical school during this period of time of not only coronavirus, which we haven't even touched upon during this conversation, but also in the context of what's happening racially within our country. And so I encourage you all to do what you need to do to stay strong and emotionally well, because this will continue to be difficult. It will continue to be an uphill battle, and we don't need folks to burn out, especially you are being the future doctors coming from HMS. We need you to not be burnt out and worn out by what is happening. All of these requests and texts from your friends, from your white friends, oh, thinking about you today and Black Lives Matter. If you don't want to respond, if you don't want to read the news or do whatever, that's okay. Do what you need to do to protect your wellness, to protect yourself, and to stay strong and resilient.
Thank you so much to all the panelists for all the questions. I think this has been a really amazing discussion. And now I'll just hand it over to Nee for some closing thoughts. Thank you.
Yeah, no, so thank you guys so much. We've had the opportunity now to listen and ask questions from phenomenal leaders doing work to further advance equity in our very non-equitable world. Thank you, Professor Lindo, for your incredible insights on race theory and discussion on policing reform. Dr. Crawford for the incredible medical background, the impact of racism on mental health, Lady Cardi for personal insights that not only underlines the necessity for change, but drove you to action, and Councilman Arroyo for the plethora of ways you are trying to make a difference by investigating and striving to institute laws that will protect Black and brown bodies as well as underserved communities at large. I think each one of you have provided such critical insights to enrich our understanding of the complex systems at play that continue to exacerbate the injustices that perpetuate the injustices we see in Black and underserved communities. I hope that everyone here continues to think about these issues and have been able to at least walk away from the words we've heard today with at least one new lesson or plan for engagement in these issues. And I just want to sincerely thank everyone who has been able to join us today. Thank you for your interest. Thank you for your attention and your desire to learn more about these problems that we're facing. Thanks to the Harvard SNMA, as well as the faculty and staff, and really everyone here today who's been able to make this webinar possible. So now I'm going to sort of share a Word doc with everyone that includes some initiatives. We've already seen a couple, but here's just a couple more if anyone wants to get engaged and see what's currently out there. And these are by no means the limitations. The document will direct you to opportunities happening throughout the country to get more involved. As I mentioned before, these are just a few ways. Hope it provides a foundation of the type of efforts currently being done and sparks enthusiasm for those interested in continuing to learn more about these issues. For those who fill out a pre-webinar survey, thank you so much. Please be on the lookout for a post-webinar survey, as we hope to see how effective this webinar was for all of you, so we can best tailor an engaging, inspiring, and impactful learning experience in the future. In the survey, in the post survey, please include the questions that we have not tried to answer, we weren't able to get to, and we'll really try to do our best to get back to them, or maybe like post the questions in another document that we'll send out addressing each one. So again, thank you guys so much again. It's truly been an honor to share the past couple hours with you, and I've personally learned so much by being here today.
Thank you, everyone, and we won't take any more of your time. We went a little bit over. We apologize for that. And thank you for your attendance.
Thank you, everybody.
Thank you very much for having us.
Yeah, this is great.
Appreciative of your efforts.
Thank you.
Ricardo, you owe me a phone call.
You got the same number?
Yep.
Let me just check my contacts, make sure I got the same number.